The cochlear aperture abnormalities. What is cochlear aperture or cochlear fossate or cochlear nerve canal? Cochlear aperture abnormalities involve malformation or absence of cochlear nerve canal, which transmit the cochlear nerve from the internal auditory canal to the cochlea. So it is very short segment between the IAC and the cochlea. This aperture where the cochlear nerve is transit from the internal auditory canal to cochlea is called cochlear aperture, cochlear fossate or cochlear nerve canal. As inner ear develop from otic placode around third gestational week and cochlear nerve differentiate by the 7 to 8 weeks. This cochlear aperture or cochlear nerve canal, it is a bony canal through which the cochlear nerve passes from fundus to the internal auditory canal to the cochlea. Normal size is more than 1.5 mm in diameter in the axial CT or MRI. So normal dimension of this cochlear aperture or canal is about more than 1.4 mm. This aperture abnormality may be first type is aplasia or complete absence. There is no cochlear nerve canal is seen on CT or MRI, often associated with cochlear aplasia or cochlear hypoplasia. So it is mostly associated with profound SNHL in the children. This is HRCT temporal bone at the level of mid-modular level showing complete absence of the cochlear aperture. You can see this arrow. Second is cochlear aperture hypoplasia or you can say narrowing. If bony canal is less than 1.4 mm and there may be associated with cochlear nerve hypoplastic or absent or hearing level may be mild to profound depending on the cochlear nerve presence or absence in this cochlear aperture. Third abnormality is cochlear aperture abnormality which is associated with narrow IAC. This is called narrow if it is less than 2.5 mm in the midpoint of this internal auditory canal. It is called stenosis of internal auditory canal. This suggests maybe absence or hypoplasia of the cochlear nerve. It is mainly seen in congenital syndrome like Charge syndrome. In cases of narrow IAC, there is a possibility that cochlear nerve is aplastic or hypoplastic and therefore imaging with MRI should be obtained. Axial and sagittal oblique high T2 weighted CISS or Fiesta imaging should be investigated to determine whether cochlear nerve aplasia or hypoplasia is present. On sagittal view, you can see there is nerve is present on this picture of MRI, and you can see another picture which showing absent of the cochlear nerve in this MRI imaging. So in CN aplasia, nerve can be identified in the anteroinferior part of the internal auditory canal. In summary, cochlear aperture abnormalities are critical in the assessment of congenital SNHL. Accurate imaging CT or MRI is essential to guide management. Cochlear nerve status directly impacts implant candidacy.